Hello everyone, I'm Dr. Ramel from City Skin Clinic, and today I am going to have a chat with you guys about lip filler migration. It's a little bit of a break from our wedding prep series, which will be back, don't worry, but this is a really important topic and I thought it would be something great for us to discuss on this channel. I wanted to share with you my thoughts on why I think it happens and how to avoid it from happening. Before I start, if you're new to this channel, welcome. Don't forget to subscribe to this channel and hit the notification bell. If you're a returning subscriber, welcome back. Thank you for your support. So, lip filler migration. This is a really important issue to discuss, I think, with the rise in popularity of lip fillers over the past few years. It is something that is being seen again and again. And it's important for a couple of reasons. One, I think it generally gives people the impression that it's inevitable and all filler migrates. And also, I think sometimes people think this is part and parcel of the process and there's nothing that they can do about it. We are, as a clinic, do everything in our power to avoid lip filler migration. This is something that we have a good track record on, and so I thought I would share my thoughts and experiences about what we do to reduce the risk of this happening. What is lip filler migration? Well, basically lip filler over time going beyond the borders of where it was placed. So if the filler was placed within the lip itself, then it might migrate and spread outwards, so above and below where the lip is. And that's where we typically see it. I think probably it's most commonly seen and most noticeable above the lip. The reason that lip filler migration is a problem, it's not that it's inherently dangerous, but it does affect the aesthetic of the lips. So in my opinion, and I think again, there's a little bit too much shaming of people's different aesthetics and whatever. My personal aesthetic preference is for everything to look quite natural, quite subtle. I think a really beautiful lip is one that's a bit enhanced, that has a shape to it, a bit of body, but it goes harmoniously with the rest of your face. And so it's kind of that enhancement. Some people like a more exaggerated lip, and that's fine. It's just something that we don't do. But this is not to kind of be dismissive of anything else. It's just to say why migration. And I think, if we're honest, I don't think anyone, even if you like really big, exaggerated lips, you like them super, super full, I don't think even in that situation anyone would be happy with lip filler migration. And the reason lip filler migration is not so great is that it blurs the boundary. So we all have a natural boundary between the outline of the lip and the surrounding areas of skin around the mouth. And that natural boundary, it's not just a difference in color or a difference in the appearance of the skin, but it's also, there's a natural curve to the outline of the lip, and that provides the lip with its boundaries. It helps with the outline of the lip. So when we get older, as we get wrinkles and loss of outline in that area, that volume loss results in a loss of that outline. So with lip filler migration, you kind of end up having sort of not much of a boundary between the lip and the surrounding skin. So that curve is gone. And what that tends to do is the lip ends up looking a little bit like a duck or a trout pout. It kind of ends up looking like there's just this whole kind of thing where the skin, there's not much of a barrier, just the only difference is the color perhaps of the lip, but you lose that. So you end up with that artificial kind of ledge. That barrier is gone, but you have like a shelf instead, which is the filler that's gone beyond its borders and it's pushing on the lip, and it's also pushing some of that skin there. And so that ledge or that step is not aesthetically pleasing, I think, to pretty much most people, because it looks really, really unnatural and because it's not really defining or enhancing the lip at all. There are a few things that you can do to manage it, but it's incredibly hard. So I would say if you are at that stage and you have this, as long as you had hyaluronic acid lip fillers injected in that area, then my advice as a general rule, if patients come to us wanting to do their lip filler, but they've got a lot of migration, my advice is either you can wait for it to completely disappear, or most likely dissolve it completely, let the lips settle and rebuild, and then restart having lip fillers if that's what you want to do. And usually that will give you a much better look. You know, it's not possible to get rid of migration by building and building and building more filler into it, because it is just going to continue to get worse. It is possible to try and correct, kind of dissolve around the lips where there is migration, but inevitably, because it's hard to control where the hyaluronidase, the enzyme that eats up, dissolves the hyaluronic acid, it's hard to really control where it goes. So undoubtedly it will kind of also dissolve some of the filler in the lips, if not all of it, depending on how much is used. So that's something to just bear in mind, that actually sometimes the best thing to do with lip filler migration is just to get rid of everything and then start again afresh once everything's settled down. You can also wait for the filler to dissolve. The problem is when filler migrates in the lips are incredibly mobile, and so filler breaks down more quickly there. But it may take much longer to dissolve naturally in the areas it's migrated to. So that's something to keep in mind. There's not really much more that you can do with migration. So this is why it's really important to try and avoid lip filler migration. And in order to do that in the first place, we need to understand what are some of the most common reasons lip filler migrates. So the first one is, it's really important to choose the right type of filler for the right area. That's why you don't use the same filler for everything, and you don't use the same filler for every patient. So in patients with decent lip volume, really good skin condition, you want to use a thicker kind of filler that's suitable for the lip area. That filler will kind of work well in a mobile area. If you use far too thin a filler for that area, it may spread out a little more easily and so have a higher risk of migration. The opposite is true for someone who is perhaps older, has really poor skin quality. If you use too thick filler in that kind of situation, then the filler may more easily migrate, because just the boundaries and the skin, there's less to kind of hold it in place. So you really need the right type of filler for each person. The other thing is injection is really important. So over injecting around the boundaries of the lips, the vermilion border, that can over time end up with a buildup of filler there that then easily migrates, because it's a very narrow area, and that can cause migration. So that's why when we do lip filler, it's not the same kind of treatment for everyone. So you assess what is going to work for each patient and what's going to reduce the risk of migration. And that's the case when people come back again for more filler over time. Each time you're not doing the exact same treatment. You shouldn't be. You should be assessing the lips and always looking to position your injections and your technique in a way that reduces all risks, gives the best results, and really reduces that risk of migration. So that's the other thing. Not everyone needs to have their vermilion border injected. That may end up causing a lot of migration in a lot of people. The other big thing that we see that we think obviously leads to migration is having too much filler in the lips. So lip fillers are amazing. They can really reshape your lips. They can give you an amazing volume. They can really enhance your lips and your face. And for a lot of people, it has such a positive effect. And I love lip fillers. But it is important to understand there are limitations. And so sometimes people with incredibly small lips will need a lot of filler. But injecting all of that filler at once is going to increase the risk of migration. It's also going to increase the risk of having a really horrible kind of stuffed sausage effect lip. So in someone who is going to need, we're going from a really small lip with poor definition and you want to build it up, then you are looking perhaps at having multiple treatments several weeks or months apart as a staged kind of procedure. That is far better. So if someone needs 3 ml of lip filler to kind of, let's say, for example, recreate the lip that they really would like, that's not going to be done in one sitting. That's going to be done in 3 sittings probably, and they're going to be spaced apart to allow the filler to adjust at each time, and also to ensure that actually you do need the next procedure, because sometimes actually you get to where you need to with less filler, but the patient's happier even if it wasn't the original outcome, but it's done enough. So it's better for us, it's better for the patient, it's better all round. So that's the other thing. So if you're going to need a lot of work, really have it done at each stage and let the filler between each session settle down, make sure there are no complications and no problems. The other thing is different fillers last for different amounts of time. So some fillers, and it depends on each person's metabolism, how quickly it breaks it up. So sometimes someone, lip filler lasts about, let's say, 6 months with them, and so maybe they will want to come every 6 to 8 months to repeat the treatment. That's fine, but in that situation we always say, just because it's not automatic, so if you're at the 6-7 month mark and the filler still there's a bit there, we might advise you to wait. The other thing is, it may be, just because you had X amount of filler the first time, maybe you need a little bit less filler the next time. It may need to be injected slightly differently. It's just really important to be aware that it shouldn't really be the exact same procedure each time. It should be tailored to you. Sometimes filler can build up over time, so that's the other thing we're quite mindful of. So we advise generally our patients that although maybe in the first 2-3 times you may be getting your filler regularly, as it's almost all dissolved, over time you want to avoid build up, and so you may want to stretch the amount of time between these, or if you really don't want to, you may dissolve what's kind of left and then do the treatment. Again, these are measures that we discuss with each patient, and it's just based on the understanding that you really want these treatments to make you look and feel your best, and that means avoiding things like lip filler migration. So those are the things to be mindful of, is that actually you want to have a very personalized approach to your treatment. If you need to build up your lips, that's kind of done over time. That if you're going to get lip fillers done regularly, you see the same person, or in the same clinic where everyone kind of works together and shares their notes, so that there is that constant monitoring, that honesty. If they think that actually, if your doctor thinks, maybe let's give it a bit longer before we do the next session, or I'm worried a bit of migration, let's take this approach or that approach. That's really important. It's a relationship, and it's your face, so it's a really important relationship to have with your practitioner. The type of filler is super important, and again, that's where it's really important to have a practitioner that takes a very personalized approach to your treatment and is not going to have a one size fits all. If you are going for lip fillers for the first time, or even if you're not, ask the questions. What can we do to avoid migration? I'm a bit worried about that, or what would happen if I had it? These are really honest and kind of fair questions to ask, as well as all the other questions you might ask about fillers. So anyway, that's kind of my 2 cents worth on lip filler migration. I hope you found this video useful. If you have any questions or comments or experiences you want to share with us, please leave a comment below. Don't forget to give this video a thumbs up, and until next time, stay beautiful.